Hello, my name's Dr. Rob Endicott from Midlands Dental Sedation Services, and welcome to my dentist information video. This video is designed to give you some simple guidelines and to give you an idea of what dental treatment under intravenous sedation can offer your patients and how it can make your life easier as well. Not only do we provide intravenous sedation, but we can also do transmucosal sedation. So I can provide oral sedation with midazolam in the form of a drink. Or we can also provide a technique called intranasal sedation, which is perfect for those patients who have a real genuine needle phobia. At Midlands Dental Sedation Services, we provide sedation for patients who are in ASA 1 and ASA 2 health categories, over the age of 18. We do work 5 days a week and sometimes on Saturdays as well. We also operate a very easy to use online booking system. So when a patient is ready to book in with you, you can bring up My Diary on the internet as well, and you can correlate the two appointments to make sure that you don't have to make any phone calls and you can book the appointments nice and easily. We provide and supply all our own equipment. All we need from you is a full oxygen cylinder on standby in case we need it. So what do we talk about when we talk about ASA? So ASA ratings are a very simple way of gauging the patient's current health status. So an ASA 1 patient is a patient who's currently fit and well, they're a non-smoker, they don't take any medication, they don't have any chronic diseases. ASA grade 2 is a patient with a mild systemic disease or some impairment on their health, but something that is well controlled. They can be a smoker, they can be a type 2 diabetic that is well controlled, but someone whose disease status does not produce functional limitations on their life. An ASA grade 3 patient, which we can sometimes treat, and you'll need to talk to us beforehand, is a patient who has a systemic illness that is slightly less controlled and a patient whose illness does have some sort of functional limitation for them. But if you've got any questions at all about the ASA status of your patient, just give us a call beforehand or drop us an email. Booking online is a very simple process. We suggest that you register your dental practice first using our registration form, and once we've approved that you are within our radius for travelling to, you can then book either a morning or an afternoon slot, and we recommend to patients that is a minimum of an hour. So if you're taking a tooth out, you can just book an hour's session, but you can book up to 4 hours if you require. On our website, we also have patient consent video and patient consent forms which you can download and give to the patient beforehand. The patient will need to be taken through those and then we'll make sure that we have signed consent forms before we start any procedure on the actual day. It's important as well that the patient is given all the options as far as anxiety management is concerned as per the GDC guidelines. We charge £200 per hour and £100 for every half hour subsequent to that. So we have a rough idea before we start how long the treatment session is going to be. We carry our own credit card machine so we can take payment directly from the patient before the treatment starts, and we recommend that the patient pays for your time before the treatment starts as well. It's very difficult and slightly unethical to start taking money from somebody who is under the influence of heavy medication. If, however, you wanted to set up a more simple fee structure and take the whole payment for the patient, you can pay us via BACS and we can sort that out separately. It's a good idea before the patient comes in that you actually watch the patient consent video as well, and then you'll be better poised to answer any questions they have. Do make sure as well that you are familiar with the sedation consent form as well. So before the session, we will contact you a couple of days before just to confirm what time the patient's coming in, and we'll endeavour to get there at least 15 minutes beforehand. Then we can sit down and go through everything with the patient, introduce ourselves, talk about the session and make sure again they are fully consented to not only what is going on with the sedation but is what's going on with the dental treatment session as well. So during the dental treatment session, I will bring the patient through, put them in the chair, introduce the cannula and induce the anaesthesia for them. Whilst that is going on, you can carry on preparing the surgery. If you're doing implant work, you can carry on setting up in the background. Normally takes about 10 minutes or so to get the patient fully induced. When you're treating a patient under dental sedation, you basically treat them as normal. You'll need to raise your voice slightly sometimes just to get them to open their mouth. but you can carry on and do your normal treatment. You can use rubber dam, you can use retractors. We carry with us a whole range of various retractors, from Optrogates to Isodries, mouth props. One of the commonest things with intravenous sedation is that the patient forgets to keep their mouth open. So it does occasionally close and we'll need to prompt the patient. But Optrogates especially are a fantastic way of keeping the patient open, so you've got full access to what you're doing. When the treatment session is completed, then I will then sit with the patient. We can transfer the patient into a recovery room if you have one, or we can just recover them in the chair. Normally after about 45 to 50 minutes of a simple IV sedation session, the patient can normally get up and walk around on their own. But I will be in charge of discharging them and make sure that they are upright and that they can walk unaided for a few steps. I'll transfer them to their carer and make sure the carer's got the written instructions, and then we will escort them out of the building. One of the major side effects of intravenous sedation is the amnesia, and sometimes retrograde amnesia as well. So it's important to make sure that when the treatment session has finished for the patient, that you don't discuss too much about what's actually happened during that visit. Don't rely on that discussion to be remembered at all. So if there's been a change in the treatment, if you've been unable to do something or you've done something extra that the patient's consented for beforehand, it's best to contact them the next day or drop them an email or write them a little note so they know exactly what's gone on. It's also a good idea to discuss that with the carer as well. So what happens when things go wrong? Fortunately, with sedation, side effects and complications are extremely rare. So what happens if we can't find a vein? This does happen occasionally, and sometimes patients' veins are too thin, too spindly, and are impossible to get to. There are multiple sites that we can try for veins, but if it really can't happen and we can't use intranasal, then we need to send the patient away. We can rebook them, we can refer them to a general anaesthesia centre or another IV sedation centre, but I do not charge for my time if I'm unable to sedate them. It is possible to over-sedate a patient. We use the SARD recommended titration dosage for sedation, so we only get them to the point where they're happy, and we do it nice and slowly. But we always carry reversal drugs with us, so if the patient does over-sedate and their SATs drop, we can get in there and recover the patient quite quickly, but that's an extremely rare event. The other complication that happens sometimes is a laryngospasm. So the back of the throat tends to close up, but if you've got the oxygen cylinder there handy, we can put on full flow oxygen and tend to reverse that quite quickly. So if a patient starts to seem like they're choking or not breathing very well in the chair and their SATs are going down, that's a pretty simple thing we can do to turn that around. If that doesn't work, again, the reversal agent will work within about 10 seconds. Of course, if you have any questions at all before you book the patient in, or once you've got the patient in, you need to contact us at all, simply just drop us an email and we'll get back to you very, very quickly.